If I'm going to get bad news, I want it from him because he's very handsome. Dr. Irwin Redlenner joins us now. MSNBC medical expert. Dr. Irwin Redlenner.
Here he became Dr. Doom.
Dr. Irwin Redlenner is the founding director of the National Center for Disaster Preparedness and senior research scholar.
Dr. Doom.
Or as we like to call him, our free telemedicine visit.
Yeah, line up.
Good morning, Doc.
I'll be with you in a moment. The doctor will be with you in a moment. But anyway,
the doctor is
guys?
in. Good. Well, so we have obviously a lot of questions. Americans will be able to receive an updated COVID vaccine as early as Wednesday. Does that mean this coming Wednesday, I guess? The CDC endorsed the shot for all Americans at least 6 months of age. You tweeted the new COVID vax is approved. There's already some weird controversy. Ignore it and get the vaccine as soon as possible. Good for all above 6 months of age. But if you are above 70, pregnant, and immune compromised, or have multiple chronic conditions, or live in a group setting, the sooner the better. So talk to us about that, because the CDC experts said every variant circulating at any significant level right now is from the XBB lineage. So this should still be effective against preventing other variants that are circulating. Just talk to us about the new booster or whatever we're calling it.
Okay. So, and by the way, these comments are going to be preventive medicine, just the comments to keep people from getting sucked into misinformation on social media. So ignore the noise. Here's the truth as we know it, which is always the caveat in science anyway. But the state of the art right now says this new vaccine is important for everyone to get. Children from 6 months of age through adults get it. That's unambiguous. What is of interest is that if you have one of several conditions, pregnancy, immunocompromised, in other words, something's not functioning properly in your immune system, or if you're older than 70, or if you happen to live in a residential group setting, whatever it might be, from prison to nursing homes, whatever it is, you are considered even more urgently in need of the new vaccine, period. Everybody should schedule for it. Those who have those conditions, hurry up and schedule it. So that's really the sum and substance of it. And there's really the only argument that you might hear, and it'll get misinterpreted for sure, is that unless you are in a risk group, not so important. That is just not the case. And we don't want people to get confused. Well, is my condition enough to make me want to be in the only priority getting it? No, it's like just plan on getting it. And by the way, at the same time, plan on getting the annual flu shot. Critical. That vaccine is coming up and you need it.
Yeah. Okay. I want to talk to you about that as well. Now I have 6 more questions. Okay. Hang on. First of all, just wanted to confirm what the CDC is saying, that because people are like, you always said this will be a race between the vaccines and the variants. And you're like, this was developed before the latest variant, but they're saying this should protect against all variants currently circulating, correct?
Yeah,
okay.
It should.
So
it should.
Go ahead.
Unless it's other variant. But yes, it should currently, and that's what we need to go on.
So to your question, because a lot of people are asking me to ask you this about the flu and RSV. You said if there's any questions, check the CDC website yourself. Most importantly, discuss with your doctor. Also ask your doctor if you're a candidate for the RSV vaccine. No matter what, please get the annual flu shot. Seems like a lot, I know, but it's a safe and great way to have a healthier winter. So people are asking me about what sequence you should do those in, and do you know what I mean? Like, what do you get them all at once? I think I got the combined COVID and flu shot last year, but talk to us about that for a second.
Oh, first of all, the RSV is different than the COVID. Obviously, it's dealing with a different situation. RSV can be a really, really tough medical condition for young babies and children, and for older people. There are some complications, so we're a little less definitive about everyone getting the RSV, and that is something you should wait on and definitely speak with your doctor, now called your primary care provider. But that's who should have the conversation with you. You should also read about it. People need to understand themselves how to read information in a credible source,
Right.
which the CDC remains. Okay. So getting COVID and flu at the same time, it's fine. And by the end of the first half of October, you should have that flu shot. You could get the COVID shot right now. You could get both of them together
Okay.
in early October, but those on the must-do list, both of those, and the RSV, a little bit more inquiry and conversation about
Okay.
you specifically is worthwhile for RSV.
So both CVS and Walgreens will have vaccines available in the coming days following the CDC endorsement. Chris had a question about, cost for a lot of people. So Rob Myers tweeted that the CDC is contracting with those pharmacies to offer free COVID vaccines to the uninsured and underinsured adults through the Bridge Access program. Do you know anything about that?
Yes, it's true. So
Okay.
certain kinds of insurance will allow you to get the vaccines free. If you don't get them free, it's about 4 times more expensive than it was last year, the COVID vaccine, which is insane. The
Right.
drug companies are making billions and billions of dollars on these vaccines. And I think to have inequity, having people with limited means having to, and no insurance having to pay more for an essential vaccine is kind of just
How,
really irks me, Stephanie.
how
This
much?
is this,
How much is
this should
the
not be the
uninsured
case.
price? How much is the uninsured price for the COVID vaccine this year?
120.
120.
About
And that
120,
that's
130.
and that's
there.
untenable
It was
for
$30 last year.
right, and that's untenable for many
Yeah.
low-income people.
Let me ask
course it is.
the legal right. This is I'm just reading from the article, Doc, to get your reaction. It said this is the first time the federal government isn't buying and distributing the shots because the public health emergency expired in May. The COVID vaccine is now commercialized, just like the flu shot or other vaccines. That puts the burden of ordering shots on hospitals, physician offices, and pharmacies, and on the public paying for it. So they're saying there could be barriers for the estimated 25 to 30 million people without insurance, without discounts. Pfizer said the shot will cost 120 per dose. Moderna said it will charge 129 per dose. Novavax 130, so about this, around the same. Uninsured or underinsured Americans will have access to free shots as part of the Biden administration's Bridge to Access program, which will keep a limited supply of vaccines and therapeutics on hand to distribute free through state and local health departments as well as pharmacies. The program is meant to be temporary and will expire in December of 2024. The Department of Health and Human Services said vaccines will be available under the program as early as this week. So that would, to me, that's even more incentive. Go do this now, right, while the Bridge Access program is operating. Yeah.
What a system, Stephanie, where you have to you have to hurry up and get it, otherwise
Yeah.
you will
Yeah.
be faced with a financial burden
Right.
that is untenable for
Right.
you. We seem to have this war on people living with limited means and no health insurance. It's incredible.
Yeah.
It's like the special tax credits given to people with children on a per child basis.
Yeah.
That was enacted or supplemented during COVID. It's now gone away. That'll put about, I don't know, 18, 19 million more children in poverty. It's so unacceptable for a country like ours
Yeah.
not to have it routine. Of course, you need
Well,
healthcare and you need vaccines.
And Doc, it seems like if ever
People
there's
should
a
be helped.
yeah, if ever there was a public interest, it's with a highly contagious airborne virus,
Right.
right? To keep
Because-
I
that.
would think.
Because
Yeah.
as it
Well,
is, there are low-income areas of cities all over the country
Yeah.
that where people aren't going to be vaccinated because they can't afford it.
Yeah.
And that is going to be a petri dish
Yeah.
for new variants.
Yeah. Well, we talked about this during the Trump administration about, screw the blue states and who cares about the brown people that make
Right.
our chicken nuggets. We live in a society. It's, if,
Yeah.
everybody's going to get it. If you don't, let me just say, this is the depressing part. In the past year, only about 20% of adults received the bivalent booster. Experts have said they don't expect much difference with the newest version. COVID cases and hospitalizations, as you know, are steadily rising. So here we are again, right?
We are here again. I don't think anyone expects this to be the worst of times that we've had with COVID, but people are getting hospitalized. People are dying right now, even before the brunt of a new COVID season hits. So it's just stupid. And the cost, by the way, if you don't get vaccinated and you get sick and you have to enter the healthcare system, which I don't know, 50, 100 times more expensive than getting prevention.
Yeah.
It's not, it's, first of all, it's not fair. And second of all, it's not logical, which is one of the things that's so aggravating about this, which has to do with really the stupidity and the ignorance of people who are making political decisions, so consumed with culture wars and what happens, who's making decisions about what happens with a woman's body, or what's in the library, that they can't figure out how to take a pause and do something that would benefit the whole country.
And here's the COVIDiocy part of the, this line in the story. Most people who've been hospitalized since January 2023 did not receive a bivalent booster. I mean, the administration, I think, and CDC is trying to market this as being an annual shot, just like the flu vaccine. The FDA said, barring the emergence of a markedly more virulent variant, the FDA anticipates the composition of the COVID vaccines need to be updated annually, as is done for the seasonal influenza vaccine. How do we get people to think of that, to just go get your COVID shot when you get your flu shot? It is still out there. How do we get people to that?
For one thing, this is something I've been thinking about, Stephanie, because we often talk about what is it that we're supposed to say to people to make sure that they do the right thing from a health point of view. And I think part of the problem lies, of course, in misinformation in social media, on the internet. It's just wrong BS that's out there way too much. And the second thing is, the fault maybe on public health officials' side is it can't be too complicated. I think that's the ringing message for this year's vaccine incentive messages. That is, here it is. It's very simple. Get the shot, period.
Yep.
If you have one of those conditions that we mentioned before, one of those health situations, then get it urgently.
Yeah. Real quick, Jeff from Salem says,
buts about it, right?
Yeah. Jeff from Salem, question for Dr. Redlenner. After almost 3 years, we finally joined the COVID club. My question regarding my wife and I getting an invite to cousin's wedding in Florida. First of all, it's Florida. Secondly, who knows what kind of precautions others will have taken. A mitigating factor, though, is that we've just gotten COVID, and after recovery, hopefully, there's a level of immunity. Did I mention the wedding's in Florida? It'd be great to get some advice as to whether to attend the wedding or not. I heard our friend Bob Seska talking yesterday about whether to go ahead with their fall trip. I think a lot of people are like, oh my God, where are we? Particularly if you haven't been able to get the booster yet, right?
Pretty simple. Get the booster. Get it now. Get it especially if you're going to go to even if you don't have those conditions that make you exceptionally vulnerable. If you're going to put yourself in a situation, or if you get in a situation where the possibility of transmission is higher, make sure you're boosted before you go, before the wedding. I'm assuming who asked that question?
Jeff in Salem. What?
Well, because Jeff is, unless he's a white heterosexual male, he probably won't be allowed into Florida.
Okay, that's funny. See, you ended with a joke. All right, and now we're long. All right, all right, Shecky. Thanks for coming. Love you, Dr. Redlenner. We'll see you next week.
Bye, guys.
All right, there he goes. 20. Carlos.
Muy buenos días.